moraliser. You don't have any ability to tell people what they will do. But your job is to be there as a sounding board, to actually explore with people their levels of involvement with drug use, their expectations, their attitudes. And in that situation, you do then have the opportunity for planting seeds, for actually making inquiry that may prompt somebody to take stock of the situation themselves, either during the conversation or subsequently. And that's really the point of the whole exercise.
Great. To talk with young people about drugs, you really don't need to be an expert in drugs. What you need to be reasonably competent at is just knowing how to talk to young people. Really, in a conversation with a young person about drugs, all of the usual things that you do in talking to young people about other subjects will also work with drugs. You don't at all need to be an expert. If there is something that you don't know and the young person does, then you will find ways of asking them, and you know, that can actually be a very helpful part of the process. If a young person tells you, you know, XYZ about a particular drug that they either use themselves or they know that some of their friends do, that actually provides an opportunity to explore what that information actually means to that young person.
So, John, what are some do's and don'ts when it comes to talking to young people about drugs in order to foster good practice?
We certainly know some of the things that we shouldn't do. We know that there's very little point in trying to lecture young people or ordering them about how they're going to change their behaviour. And the straightforward reason is that it just doesn't work. It would just be futile. So what we're needing to do is to set up a situation where we're having a two-way conversation with them, discussing with them about their own views on the choices they make around alcohol, drugs, smoking. These are decisions that they are going to have to make, and we can contribute to this process and stimulate the beginning of an ongoing appraisal. And that's very much the nature of the work. We're trying to set in motion a reappraisal for that young person, which will then go on well after the interview that we've had is finished. We're planting some seed, planting some uncertainty or exploring some ambivalence with them about their drug use, which may then actually mature long after the interview's finished.
So what is ambivalence and why does it matter? Well, ambivalence is simply feeling two ways about a behaviour. So there being some things that you like about the behaviour and other things that you're not so keen on. Now, although ambivalence is very common, it can also be uncomfortable. You know, sometimes it's not easy to feel two ways about things, and perhaps this is more likely to be the case when the behaviour in question means more to you. Either that it's something you're spending a lot of time doing, or it's something that you're actively worrying about. And in these circumstances, it is particularly important that anyone trying to help you think through these ambivalent thoughts and feelings is very, very careful about what they do.
Also, it's important to try to make sure that we don't lay blame, we don't try to apportion blame, and we also try to avoid labels that might be applied. Labels such as addict or alcoholic, these are likely just to alienate the young person. They're likely to mean that any discussion that we've had is immediately discarded. So by avoiding attributing efforts to attribute blame, we're far more likely to be able to make progress in the discussion with that young person. It's also important to have realistic expectations about what's likely to be achieved in a single interview. You're explaining to young people that they are making choices. They aren't helplessly moving forward with their use of any of these drugs. they are making choices at each step of the way. And that's the essential ingredient, that's the essential objective behind this approach.
How should you talk to young people about drugs, particularly young people who are ambivalent? Well, first of all, there are a number of things that you should specifically avoid. The first of these is allowing a discussion to descend into a question-answer dialogue. Now, this is important because if you are asking the questions and only requiring the young person to provide answers, the direction of the discussion is very much following your agenda and not the young person's agenda. Taking sides can become a barrier to that young person telling you how they see the situation, which is really what you want to happen in a conversation.
So, John, is there anything else we should know about when it comes to talking to young people about drugs?
Motivational interviewing is a new technique that we've become particularly interested in applying in this area, where it provides an opportunity to explore with the young person their ambivalence about these different aspects of drug use. And this is a one-to-one method where we are helping to mobilise the exploration of different potential pathways that the individual might go down.
There are 5 techniques in motivational interviewing that we teach practitioners as guidance for how they